Goni skill, hip flexion. Assist the patient to the supine position. Make sure the knees are extended and both hips are in a neutral position. In patient-appropriate language, ask the patient to actively flex the hip while you palpate the pelvis at the ASIS with one hand to assess for posterior tilting or rotation. The contralateral limb should remain in the neutral position. Support the lower extremity and passively flex the hip to end range, allowing the knee to flex as you move through hip flexion to lessen the tension on the hamstrings. While stabilizing the pelvis with the other hand, assess the end feel of the joint, which should be soft because of contact between the muscle bulk of the anterior thigh and the lower abdomen. The end feel may also be firm because of the tension in the posterior joint capsule and the gluteus maximus muscle. However, most commonly it is soft. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the greater trochanter of the femur. Recall the technique taught in lab to identify the greater trochanter. Align the stationary arm with the lateral midline of the pelvis. Align the movable arm with the lateral midline of the femur using the lateral epicondyle as a reference. Again, utilize the technique taught in lab to identify the lateral epicondyle. Ask the patient to perform hip flexion as previously, maintaining alignment through the entire range of motion and observing the pelvis for any extraneous movements. Read the degrees of motion on the goniometer, and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 120 degrees.